Welcome back. My name is Dean Berg and you're watching the instructional video series from Anika Media on the benefits and ultimate ROI of leveraging social media in healthcare. In the last few videos, we talked about some of the largest challenges that we face in healthcare today and about the notion that a strategic social media program can have a significant impact on our goals and objectives. But before we dive into how a strategic social media program can impact our goals and objectives, we must first understand our customer, our consumer, our patient. And as we look to better connect with our patient, we must also understand how that patient is evolving. Who are we looking to connect with? Well, we're looking to connect with our patients, of course. More specifically, our ePatients. Technically, we're looking to connect with our caregivers and our adult children as well, but for sake of simplicity, we'll refer to them all as ePatients throughout the video series. Recent estimates have put this number above 150 million adults in the United States. Irregardless of the specific number, people are finding their doctors and their hospitals online. They're finding their healthcare information online. Amazingly, more than 50% of these people go online as their first source of healthcare information. Before they consult with family, friends, their physician, before they go to urgent care or clinic. This has the potential, at least, to be good news. Our ePatients are always on, always connected, and always sharing. What do we mean by sharing? Not only do people find their doctor online, but they share their healthcare experience online. They share it not only with a friend sitting face to face, but they share it on their Facebook page. They tweet it to 1,000 of their closest friends, who then retweet it to 1,000 of their closest friends, etc. This is leverage. This is amplification of your brand. And when these people post a comment on your website, we call that social proof. We are a social species. This comment on your website will reassure others who happen to visit. That is good news. People in the digital world consider email passé. They distrust ads. They even skip ads via DVR. They post comments about their brand experience. Amazingly, they will accept a recommendation from Facebook, Twitter, or texting with the same amount of weight, with the same level of trust, as if it was coming from a friend sitting face to face. People are finding and sharing, sharing and finding. This is significant news. Our ePatients are basing their choice on brand. What do we mean by brand? What is brand? Or more importantly, what is your brand? If you had to define brand with one word, what would it be? Image, perception, reputation? All of these are good. I personally like reputation, but it's even more than that. It includes emotion. It's that package of stuff that people think of when they think of your hospital or your practice. It's image, perception, reputation with some emotion, all mixed together, portraying your hospital or your practice in the digital world. It's your digital footprint. So what? What does social media have to do with your brand? How can we leverage social media to enhance your brand? Well, the Mayo Clinic uses social media to better connect with their ePatients. What do we mean by connecting? Let's define connecting via the 3 E's: engaging, educating, and easy. We'll start with engaging. Engaging is bidirectional communication. It's not a monologue, it's not a broadcast, it's speaking and listening. It's bidirectional. The Mayo Clinic does a phenomenal job of engaging their ePatients. This is just one example. Their Facebook page. By the way, has anybody heard the number 8675309? Let's talk about educating. Educating is providing accurate, useful healthcare information. I think accurate is fairly self-explanatory, but let's talk about useful healthcare information for a second. What do we mean by useful information? I guarantee you that two doctors could hold a conversation about a certain symptom, condition, diagnosis in such a way that I would not understand 99% of the conversation. I'm not a physician, a clinician. I don't even work in a hospital. I'm an engineer by education and a marketer by experience. Useful information is information I can use. And before I can use that information, I need to understand that information. Educating is providing accurate, useful healthcare information. Another great example from the Mayo Clinic. They provide very educational videos on their YouTube channel. Phenomenal example. Let's talk about the third E, easy. Without easy, the other two may be lost. Easy or ease of use, ease of finding information. Doesn't matter how engaging it is, doesn't matter how educating it is. If we can't find the information, it's useless. Two quick examples. The Cleveland Clinic, one of the best in the business. They allow you to find a doctor from their homepage in 5 different ways. They've done their homework. They know how people search for doctors, and they've covered the bases. Very easy. And one of my favorites, the symptom checker from Henry Ford Health System. How easy can it be? Even an engineer can figure this out. You simply point to the part of the body where you have a symptom, and it allows you to quickly navigate or to drill down to the specific healthcare information that you're looking for. It's extremely easy. So we use engaging content, educating content, and easy to help us better connect with our ePatients. We've talked about our ePatients. We've talked about your brand. We've talked about better connecting through the 3 E's. Now we're ready to talk about how a strategic social media program can better help you to meet some of your goals and objectives. In the next few videos, we'll talk about patient retention, patient recruitment, and operational efficiencies. Please select the next video from the list, or if it's not yet available, feel free to register and we'll notify you when it does become available. And if you'd like to calculate your own potential ROI within your own environment, please download our free digital workshop. Our digital workshop consists of a workbook and accompanying video series to walk you through the step-by-step process of calculating your own potential ROI. I thank you for listening. I hope you've enjoyed the videos, and we hope to see you in video number 5.